Welcome to this presentation on biomedical therapies, which are covered in Chapter 15 of your psychology textbook. Biomedical therapies are one option for treating psychological disorders. And these are therapies that directly affect the biological functioning of the body and the brain. They include drug therapy or psychopharmacology, psychopharmacotherapy, electroconvulsive therapy, ECT for short, sometimes mistakenly referred to as electroshock therapy, and psychosurgery as well as new emerging technologies. So the ones that are most commonly used are different types of psychoactive medications or drug therapies to treat various psychological disorders. For some people who do not respond to medications, electroconvulsive therapy may be considered, especially for people with severe depression. And we'll talk about that later on in this presentation. And then psychosurgery is something that has been done in the past. Have you ever heard of prefrontal lobe lobotomies? That's an example of a type of psychosurgery where they were actually going in and destroying brain tissue as a way to try to treat some of the symptoms of various disorders. Today, prefrontal lobe lobotomies are no longer done, but doctors can use lasers and be more precise in what brain areas they're targeting and what connections in the brain they're severing. The first type of biomedical therapy that we're going to talk about more in depth is psychopharmacology. And this is the treatment of mental disorders with medication, more simply referred to just as drug therapy. And we're talking about the use of psychoactive drugs here. And these are drugs that can cross the blood-brain barrier, go into the brain, and then have effect on the brain's functioning. Therapeutic psychoactive drugs fall into four main categories. There's antipsychotic drugs, anti-anxiety drugs, antidepressant drugs, and anti-manic drugs, which are sometimes also referred to as mood stabilizers. The first type of drug I would like to discuss is the antipsychotic drugs. These are commonly prescribed. They're approved by the FDA to treat symptoms of schizophrenia. They may also be prescribed, and this is true of any of the drug classes, for people with other disorders or symptoms as off-label uses. Antipsychotic drugs were some of the very first psychoactive or psychiatric medications to be developed and offered to patients with psychological disorders. Back in the 1950s, Haldol, which is short for haloperidol, and Thorazine were two of the early antipsychotics to be developed. And these are now referred to as first-generation antipsychotics, and they are still used sometimes today. They have a very strong effect in the brain. They can go into the brain and block dopamine receptors, so they're considered dopamine antagonists. And they're very effective at alleviating positive symptoms of schizophrenia, which are hallucinations and delusions. But since those drugs were originally developed, there has been a newer type or second generation of antipsychotic drugs to be developed and come out on the market. And these drugs have a slightly different chemical structure and work a little bit differently in the brain. Some antipsychotics in the second generation are risperidol, which is short for risperidone, clozapine, olanzapine, also Abilify and Seroquel are two you might have heard about because there's a lot of advertisement for them on television and in print. These drugs are also sometimes called atypical antipsychotics simply because they work differently in the brain and have a different chemical structure than the first generation, the typical antipsychotics. And so in the brain, these second generation atypical antipsychotics still, for the most part, block dopamine receptors, but they are weak dopamine antagonists or partial dopamine antagonists, and they also affect many other neurotransmitter systems. Many of them bind to serotonin receptors as well, for example. And these drugs have shown to be effective at alleviating not only the positive symptoms of schizophrenia, but also the negative symptoms as well. And that's the lack of motivation and the social withdrawal, the flat effect, which is a lack of emotion and emotional expression, possibly a lack of movement as well. And then they also can help people with schizophrenia improve their cognitive functioning as well, because that is another key symptom of schizophrenia, is deficits in cognitive functioning like attention and working memory. Anti-anxiety drugs are another class of psychoactive medications that are used to treat anxiety disorders. Xanax, Valium, Ativan are some commonly prescribed anti-anxiety drugs. They're all in the class of benzodiazepines. And although they're made by different pharmaceutical companies, they have really similar mechanisms of action in the brain. They all increase GABA activity in the brain, and that is how they have their therapeutic effect of inducing calmness and relaxation. And that makes sense, right, if you think back about what the function of GABA is in your brain. And GABA naturally induces calmness and relaxation, and high levels induce sleepiness as well. I will say one thing, though. You may or may not know that it is not advisable to take anti-anxiety drugs like Xanax while consuming alcohol, but you may not know why. And the reason why is because alcohol is also a GABA agonist, and alcohol and this class of drugs work similar on the same system in the brain, and it can be dangerous if someone is mixing alcohol with anti-anxiety drugs, because it can become easy for them to unintentionally overdose. And while a little bit of alcohol will help you relax and be uninhibited, too much alcohol can be very dangerous and fatal, and that level can be reached quicker when anti-anxiety drugs are also in the mix. The next class of psychoactive drugs are anti-manic drugs, which are also sometimes referred to as mood stabilizers. These drugs are used to treat bipolar. So people with bipolar, this was previously known as manic depressive disorder. They go through periods of depression followed by periods of mania, which is feelings of euphoria, really elated moods, having tons of energy, being very impulsive, wanting to stay up all night, talking nonstop, having lots of grand ideas. And so for people with bipolar, they usually do not do well when given an antidepressant drug, because it'll shoot them into a state of mania. And so they need to be given a different class of drugs, these mood stabilizers, which will help keep their emotions within the normal range. And one anti-manic drug that has been used for a long time is lithium. And yes, I'm talking about the element lithium, like on the periodic table. And it's not really known for sure how lithium works in the brain, but it has proven to be effective at helping people with bipolar manage their symptoms, and more effective than many other drugs currently on the market, so it's still used today. And to be honest, a lot of these drugs, we aren't sure exactly how they're working in the brain or what mechanism of action is responsible for their therapeutic effect. But people who are taking lithium do have to have their blood levels monitored to make sure that they don't have too much lithium building up in their body, because it can have a toxic effect. I know that Seroquel, which I mentioned previously as an antipsychotic drug, has also got approval from the FDA to treat symptoms of bipolar. Antidepressant drugs are the fourth type of psychoactive drugs, and these ones are used to treat depression. Also, it's becoming more common that someone with an anxiety disorder may be prescribed an antidepressant drug as well. Some doctors believe that depression may be underlying many people's anxiety, and the antidepressant medications are also seen as a safer alternative to the anti-anxiety drugs. We talked about how the anti-anxiety drugs can be dangerous. If taken in combination with alcohol, can lead to unintentional overdose. But the anti-anxiety drugs like Xanax and Valium themselves also have a potential for abuse because they are very fast-acting in the brain. Whereas antidepressant drugs do not have an immediate effect. In fact, it's recommended that people wait 6 to 8 weeks before they, expect to start seeing significant changes in their mood. And there are several different subtypes of antidepressant drugs, but some that you might have heard of that are commonly prescribed are drugs that are in the class of SSRIs, which is short for selective serotonin reuptake inhibitors. This class of drugs includes Prozac, Zoloft, and Paxil. All these drugs have a similar effect in the brain. They block the reuptake of serotonin, and so that serotonin molecules remain in the synapse for longer, and they can continue to bind with serotonin receptors on neighboring neurons. And so it's increasing the serotonin activity in the brain, and we see that for some people these drugs are effective at alleviating their symptoms of depression and helping to improve their mood. And so researchers have worked backwards from that and thought, well, if we give someone who's depressed a drug that increases their serotonin and they start feeling better, well, maybe their depression was caused by low serotonin levels in the first place. In reality, it's much more complicated than this, but you might hear about, low levels of serotonin being linked with depression, and this is really where that storyline about chemical imbalance causing mental illness has kind of arisen from, and looking at how different psychoactive drugs can alter the level of different neurotransmitters in the brain and possibly have a positive effect on one's mood and emotions. So when evaluating drug therapies, we see that there are both pros and cons to using medication to treat symptoms of psychological disorders. Some benefits are that these drugs can provide relief for severe disorders that cannot be helped by other therapies. If someone is so depressed that they don't even want to get out of bed, it's going to be very hard for them to get to their appointments with their psychotherapist and engage in productive conversation and work during that therapy session. Maybe they get started on an antidepressant, and then after a month or so of taking that antidepressant, they will have enough energy then to start going to psychotherapy and benefiting from those sessions. But critics argue that these drugs are in reality only treating the symptoms of disorders and not the causes. And there is some truth to this. I mean, you think, so someone who is depressed, they take their medication for 6 months, they start feeling much better, and then they think, oh, well, I'm no longer depressed, I don't need to be taking my medication anymore, and stop taking it. And this is actually a really bad idea. Even antidepressants are not something someone should stop cold turkey. They need to go and see their doctor, and they need to slowly lower the doses they're taking each day, because if they just stop cold turkey, well, they can actually have withdrawal symptoms, and they can have a relapse, another depressive episode, because the body has become accustomed to the presence of these drugs or these chemicals. And so it's, making you think, well, long term, am I going to be taking this medication for a year, for 5 years? What, is the true cause of someone's depression or anxiety? And is there another way to treat that through cognitive behavioral therapy, for example? Other people say that drugs are overprescribed and people in our society are over-medicated, that drugs are being given as a quick fix for disorders in which there really is no quick fix, or to people who could possibly benefit from psychotherapy, but instead are just going to see their doctor and getting a prescription and then being sent on their way. And it's unfortunate that that is happening, because the most positive effects are experienced when people are taking psychoactive medication in combination with psychotherapy. And then the third con here is some people say the side effects of psychoactive medication can be worse than the symptoms the drugs are used to treat in the first place. Common side effects are things like headaches and nausea, but it can also be more serious, with antipsychotic drugs. Prolonged use of them can cause motor disorders, significant weight gain, putting someone at risk of obesity-related disorders like diabetes. So you can see where there is a concern about those side effects. Or what happens sometimes is someone's given a antipsychotic drug to treat their symptoms of schizophrenia, but then they need a second drug to treat the side effects of that first drug, and so on. And now all of a sudden they're taking 5, 10 different medications on a daily basis. And I don't want to say that medications are bad, because they're not, and for some people they can really be life-saving, and they can help them go back to work, go back to caring for their children, go back to school, and lead a productive life. But this is something that I think is important to consider, the pros and cons, and you have opportunity to discuss and read more about the issue of over-medicating people in today's society on our discussion board for this week. Another controversial biomedical treatment is electroconvulsive therapy, ECT for short. And in electroconvulsive therapy, an electrical shock, electrical current, is used to produce a cortical seizure in the brain, which is accompanied by convulsions in the body. ECT is primarily used today to treat severe depression, and I should say that it is reserved more as a last resort option when someone is not responding to medications. They've tried several different types of medication. Then their doctor might recommend that they consider ECT. In the past, ECT was, I don't even want to say barbaric, but had more severe side effects because we didn't have all the medical advances we have today. Today, it's done in a hospital setting, under medical supervision, and the patients are given an anesthetic so that they aren't awake, they have no memory of the procedure, they don't feel any pain, and they're also given muscle relaxers so that the body convulsions are not near as severe as they used to. And it is true that in the past, before we had muscle relaxers, people who were receiving ECT had to be strapped down or held down, and they may, have broken bones during this brief procedure. But now the risk of that is very low. And the electrical current is being applied to the brain. They will put an electrode on the temples, behind the ear, on one side or both sides of the head for only a second. So it's just triggering a brief seizure, and it's a safe amount of electricity that is not, lethal in any way. But it's not like people can get this electrical shock just once and then walk out of the doctor's office immediately feeling better. Typically, patients need to receive 6 to 12 treatments or sessions of ECT over a course of a month before they start to see significant improvements in mood. So there are pros and cons as well to using ECT as a way to treat depression. Proponents of ECT say that it is very effective for depression in those patients who are not responding to medication. And it could be a life or death situation. If someone is so depressed that they're contemplating suicide, this really could be a life-saving procedure. But opponents say that it's no more effective than a placebo. There's always a risk of placebo effect with any type of treatment, and that's true even with psychoactive medications, that maybe it's simply someone is believing that this antidepressant drug is going to make them feel better, and therefore they report feeling better. But they also say that ECT has some serious risks associated with it. And even the proponents will admit that memory loss and impaired attention are common side effects of ECT, but they say these are mild temporary side effects of treatment, and the benefits far outweigh these risks. The critics say, though, that these cognitive problems, like the memory loss, can be more severe and sometimes permanent, and could be a reason for someone not to elect to have ECT done. So I would like to be able to link a YouTube video directly into this slide, but I don't think I'm going to be able to get it to work at this time. But if you would like to see what ECT looks like in the modern day in a hospital in the U.S., I found a short video put together by UCLA Hospital, and I put a link to it on our e-learning course site, and you can hear from patients who have received ECT what it was like for them, so you can be a little bit more educated about this viable and effective treatment option. Thank you for listening to this presentation, and I look forward to reading your thoughts on this week's discussion boards.